Well, emergency medical services workers in the Western Cape say they fear becoming the next victims of COVID-19. EMS staff downed tools on Saturday over a lack of personal protective equipment. They now face the threat of not receiving their salaries if they don't return to work. ENC's Ronald Masinda has the details.
These are some of the heroes at the front line in the fight against COVID-19. But health workers also need protection against the virus.
This is what EMS, what our management feels is proper PPE according to them. It's the visor, the mask, the apron and the gloves. We do that for COVID, positive and suspected. And tonight, we must go home with our uniform back to our families. Exposing our families, exposing ourselves and even the community.
The emergency staff here in Khayelitsha say health authorities are trying to cut corners by not investing in adequate PPE for them. The Western Cape Health Department says a strike and subsequent shortage of healthcare workers is the last thing the province needs right now.
The Health MEC says the national government has provided different guidelines for different categories of emergency staff to follow when using PPE. In serious COVID-19 cases, workers need to be covered fully with proper gear to make sure they are not exposed. But in less serious cases, workers aren't getting the same kind of PPE. The MEC says workers are asking for more than what they need. At the same time, she admits the province cannot afford to be without emergency workers.
Even if there's one person who doesn't come work without even downing the tools, if you have got even a sick person or person, even currently for some of the health workers who might be on 14 days quarantine or others isolation, it will have a huge impact.
The lack of emergency staff has forced the provincial government to call on volunteers to assist during the outbreak. With the Western Cape being the epicenter of the virus in South Africa, workers say their only demand is for adequate protection against the virus. Ronald Masinda, Cape Town.